Kia ora. My name's Sally Cartwright, and as Mark said, I started 4 months ago at Body Positive as the new health navigator. I'm really nervous and a little scared, so please bear with me. I'd like to talk about my role and why it's important and the impact I'd like to have. But first I'd like to start with an example from my job. So I had a gentleman come into contact with us recently. He had been diagnosed many years ago with HIV. He had limited information about his diagnosis. He had never been engaged in care. And although he had family support and had disclosed to them his status, he'd never actually had a conversation about HIV. He'd never been involved with social supports or just anything. So I had the privilege of spending a lot of time with this gentleman, and we ran like family hui's and had lots of conversations and did odd things for him. And now he is engaged in medical care. He's about to start antiretroviral treatment. He has open conversations with his family and his friends about HIV, and he has come to accept his diagnosis and have real conversations, and and it's been a really good progression. So that's a success story in my job. Okay. This graph shows the annual number of people diagnosed with HIV in New Zealand from 1985 to present. And what this graph tells us is for the last 5 years, diagnoses have risen in New Zealand, and last year we had our highest recorded number of HIV diagnoses. And there's approximately 3,200 people living with HIV and AIDS in New Zealand. This graph also shows us that although MSM, males that have sex with males, are the most affected population in New Zealand, that other communities are also affected. If we examine the MSM, a third of new diagnoses last year had CD4 counts of less than 350, and this indicates that they were unaware of their diagnosis for about 4 years, and this would have impacted on their health and well-being. This is the Cascade of Care. It's also called the care continuum in a lot of research that I found. The purpose of my role is to really work somewhere between you can't actually see it on the graph, so the testing and the diagnosed part of the graph. And I feel like it's where the greatest impact I can have, so that when an individual or a person is diagnosed with HIV, I can help them link into care, remain in care, and adhere to ART medication to become virally suppressed, or undetectable, as we say. Research suggests that if people are living with HIV don't understand and don't accept their diagnosis, don't engage in services or social supports, or adhere to their medication, they can fall out of this care continuum. It's really important to note that the care continuum isn't linear, so people can often jump to and from this. My long-term goal is to flip this cascade of care on its head and reverse it. San Francisco has successfully done this, and they have basically stopped the HIV epidemic, and they've decreased their figure of recently diagnosed people with HIV. And they've achieved this by linking people into care early and helping them remain in care as soon as diagnosed. Which brings me to medication. So it's really important to note that HIV is a manageable disease, and medications have changed dramatically since the early days of the Yeah. The goal of antiretroviral medication is to move your viral load down so you can ideally become undetectable. And with the success of HIV medication these days, people living with HIV and adhering to their medication are living longer. And the START study recently has shown this. This is also supported by the World Health Organization guidelines that say that anybody living with HIV should have availability to ART medication as soon as possible after their diagnosis. Once starting and adhering to ART medication, you can become virally suppressed or undetectable within 3 to 6 months. Currently in New Zealand, there is a threshold barrier of a CD4 count of 500 before you are prescribed antiretroviral medication. And this also limits the amount of people that can get medication. Organisations such as Body Positive are trying to work with Pharmac and other organisations in the hope that when people are ready to go on medication, that they'll be prescribed medication, irrespective of their CD4 count. So not just getting prescribed medication, but adhering to medication is very important. When people don't adhere to their ART medication, they can become resistant to the medication, and this has negative side effects. It's really important to note that there are often barriers to adherence, and these can include poor access to services, discrimination, stigma, isolation, mental health, addiction, financial stress, ineligibility, so it's very hard to get medication prescribed if you are here on a student visa per se. Misinformation, confusion, and insecurity such as insecurity of housing or food. A huge part of my job is supporting people to remove barriers to medication and to increase adherence to medication. Sometimes other things in life can take priority to HIV treatment. And it's really important to know that that's okay and it's perfectly normal. This is the core determinants of health. My role is to work with clients to identify their individual needs, wants, hopes and dreams, and to help them in any way I generally can. I offer support, referrals, connection to care, and provide information such as HIV diagnosis, disclosure, risk, safeties, and strategies to increase well-being. Generally, some of these can include WINS, mental health, referrals for drug and alcohol, referrals for counselling, just general information, housing assistance, information about retention and care, adherence support, just general social support, and helping to remove stigma and discrimination. Okay, and my final slide is on prevention. Okay, so basically this image demonstrates how the Cascade of Care can be flipped in a prevention model. As you can see, the blue models, the blue graph is new infections, and the red is prevention to increasing testing, diagnosis, treatment, and engagement in care. And the orange is PrEP, used amongst at-risk populations. And PrEP is pre-exposure prophylaxis. And it's a pill taken every day to prevent the transmission of HIV. So basically this graph demonstrates in this first bar of scenario 1 what HIV rates would look like if we continue doing the same prevention model, such in the US, thanks Mark, such as mass promotion of condoms to the general population. If PrEP was used and promoted amongst the high-risk population, say someone who's living HIV positive, that engaging in risk behaviour with a negative person who was on PrEP treatment. This could prevent 48,000 HIV infections. The last bar, scenario 4, is if people diagnosed with HIV were linked into care, remained in care, were on treatment, had undetectable viral loads, and PrEP was promoted and used, we could flip the cascade of care and lower the transmission of HIV infections. In Denmark, they have the same population size that we have, and they have basically eliminated HIV transmission by doing this. Essentially, they've increased walk-in clinics, they provided HIV testing, linkage to care, they haven't had a CD4 threshold for many years, they've increasing treatment to anyone, and they offer a wraparound support and increasing people on treatment so that they are undetectable and virally suppressed. Okay. In conclusion, people with HIV often require support and wraparound services, often due to increased stigma, discrimination, isolation, and lots of other complicated things. My role is important to help remove these barriers and help increase access to care. Thank you for your time.